Hey everybody, Dr. Jean-Pierre here from the Upper Southern Florida. And today in this lecture series, we're going to be talking about sciatica. Okay, that's something that a lot of you may be suffering from. And hopefully today will give you some clarity on what actually sciatica is and what are some of the things that you can do to fix it. Also, what can we do here as upper cervical chiropractors and NUCCA chiropractors? How can we actually fix that? All right. So here we go. What is sciatica? A lot of time people have back pain and sciatica. It's two different things, but sciatica is from the nerve, the sciatic nerve. The sciatic nerve is one of the biggest and largest nerve in the body, and it goes from the bottom of the lumbar, which is the L4, L5, S1, S2 region. So if I can show you on the spine here. So if you look at the last two vertebrae in the spine, the lumbar spine, the L4, L5, and then right in the S1, S2, you have fibers of the sciatic nerve that comes from this and go all the way down behind the buttocks and goes all the way down to the lower leg. So a lot of time when you have inflammation around that area, that put pressure on the sciatic nerve, and that can cause sciatica. So we're going to get in depth on what sciatica is and what are some of the causes and how can we fix it. So a lot of time, what does sciatica pain looks like? You may have, of course, you always hear people say that they have shooting pain down their legs. It may not go down the legs. It may go down to the buttocks, or it may go all the way down your legs. You have antalgic gait where you're walking and walking is difficult. You have pain in the lumbar. You have pain that goes down here and it's always like shooting sharp. Some people may experience it all the time, or it can happen with movement. Common cause of sciatica can be things like, definitely herniation, specifically in the lower lumbar, putting pressure on those nerves. You can have a fracture. You have an injury or fall that may cause injury here. There's something called spondylolisthesis, and that's a big fancy word that says that, that vertebra has slipped forward on top of the other. Spinal canal stenosis. Spinal canal stenosis is just where the spinal cord comes in, where there is a narrowing of the spinal canal that's going to put pressure on that. Herniated disc, that's the most common thing that we know about. Again, trauma happened, you have a herniation that happens, and that put pressure on that sciatic nerve that can cause sciatic pain. It can be on both sides or it can be on one side. Unfortunately, sometimes you may have things like tumor that may cause pressure on that. But also there's something that's not really sciatica, but that causes sciatic-like symptom. And most of the time, that's what people are experiencing, not necessarily sciatica. And that's why we call it piriformis syndrome. Piriformis syndrome is just what it is, the piriformis muscles that attaches from the sacrum here and goes to the greater trochanter or the top of the leg. And that muscle, when it gets tight, that can actually put pressure on the sciatic nerve as it goes through it and goes all the way down. So piriformis syndrome pretty much can occur when you have an injury, or a lot of time when people spend so much time sitting. And nowadays we spend so much time in front of Zoom that a lot of people are experiencing those sciatic-like pain. But the piriformis syndrome is purely due to the piriformis muscle being tight or inflamed, putting pressure on the sciatic nerve, which can give you sciatic symptoms. Okay, so these are all the symptoms that can happen, or all the reason why people can have sciatic pain. But the most common thing is a spinal misalignment. And again, when you have a spinal misalignment, your spine is the structural that keeps everything. When you have that misalignment, that in itself can cause the herniation. That can cause the displacement, the spondylolisthesis. That can cause the tightness of the piriformis. All that can happen. And to a certain extent, when you have a misalignment of the spine, that it can ultimately resolve in having that tumor, which is far-fetched, but I can connect it, I promise you. So the main thing is having a misalignment of the spine, because the spine is a structural connection that connects everything. That can lead to all these things, ultimately leading to sciatica. Okay, sciatica is something that's not fun. It's often associated with low back pain because of the region of the sciatic nerve. So a lot of time people experience low back pain, sciatic pain, pain down their legs, numbness, tingling. All this stuff can happen when we have sciatica. All right, let me put this down and then we'll talk a little bit more. I have a couple questions that people have asked me, and I want to go over them. And again, while we're on live, if you have any question whatsoever, please type them. That way we can answer them. What should you expect during a NUCCA adjustment? We'll talk about that in a little bit. NUCCA, which is what we do, it can actually fix sciatica? Again, yes, a lot of time people are very skeptical because I'm adjusting up here in the atlas region. How can that affect sciatica, which is down the buttocks? We'll talk about that, and you'll be surprised what the answers are. Let's see. Treatments. Well, again, there's many treatments when it comes to sciatica. First, you want to figure out what's the cause. From all the things I just talked about, what is the cause of sciatica, and then we can treat effectively. But a lot of time, if you have soreness, pain down the legs, ice immediately can actually decrease some of the inflammation that we talked about. And then eventually, after the initial 48 hours, you want to do some heat to decrease the pain of the muscle, to relax those muscles, to kind of give you some relief. I don't want to talk about this, but typically, a lot of time, due to the pain, and anti-inflammatory can be good as well, over the counter, just to decrease the edge and to get rid of the inflammation. But again, medication doesn't fix anything. It just gets you through in order to get to the bottom of the problem where you can actually fix it. Again, of course, stretching. A lot of time, specifically if it's a piriformis problem, there's tons of stretches that you can do that's going to help alleviate some of the pain. But bottom line is you need to be moving. Movement is key. A lot of time, people with sciatic pain, movement hurts. You have that painful gait. But movement is key. Like I always say in my office, motion is lotion. The more you move, the more the joints are lubricated, the better you are. So flexibility, you need to move in order to get everything loosened up and get everything back in proper position. So those are some of the treatments that you can be to help with sciatica. And we talked about what causes sciatica. We talked about that. Let's see. What sciatica feels like, and we talked about that as well. Sciatica feels like it can be back pain down the buttocks, and in some cases, again, can feel pain down the legs. Some people describe it as you feeling a zap in your butt that kind of stop you in your track. It can be more severe, where it's actually painful all the time, and may even lead to some weakness and numbness in that area. Again, it doesn't have to go all the way down the toe, but anytime we have any spasm or electric shock going down the buttocks, that's usually referred to as sciatica. Again, we talked about it can happen because of sitting down for a long period of time, but there are other causes. So let's talk about the alignment issue and how we can fix sciatica and what NUCCA is and how it can help. And I've seen a lot of patients with sciatica, and they're always surprised how well they do under this kind of care. Because again, I'm at the other direction. I'm not here. I'm up here. So here's the thing: when your spine is aligned, spine is important because we always talk about posture, but we talk about structural. The spine houses every single nerve that goes from the brain to communicate to the rest of the body. And in this case, we're actually talking about one of the lowest nerve, which is the sciatic nerve that goes all the way down to your legs. However, when that spine is out of position, guess what happened? You have pressure throughout the entire spine that can cause, disc herniation, that can cause spinal stenosis, that can cause the spondylolisthesis, all the things that we talked about. And of course, if there's a misalignment or imbalance, that can cause muscle tightness on one side versus the other, and that can actually cause what we talk about, the piriformis syndrome. So the spine being out of alignment is key to getting rid of sciatica, but also the spine being out of alignment can be the key cause of sciatic pain, which is why we are so successful as taking care of sciatic problems, because what we're doing here is realigning the entire spine using the atlas as a lever to allow the body to kind of heal itself. So when somebody come in the office, one of the tests that we do to determine what's going on, it's a balance test, and we call it a weight distribution test. Why is that important? And you can do this at home if you want, or go to the store, get two identical scales, okay? And what you're going to do is put one foot on one foot on the other, and just stand there and see what happens. Again, if you weigh 100 pounds, you expect to be carrying 50 pounds on one side and 50 pounds on the other. But if there's a misalignment, specifically at the atlas can create spasm or tightness of the paraspinal muscle all the way down the back. And typically the representation is your head will tilt to one side, your shoulder will come up on one side, and the hip will be imbalanced on one side versus the other, making you weigh put more weight on one side versus the other. Okay. So if you get on these scales and you're carrying 60 pounds on one side and 40 on the other instead of 50-50, that's an indication that you're off. Now, guess what? The side that you're putting more weight on there can be the side that you're putting pressure on the sciatic nerve. But eventually what's going to happen is when the pain is there, you're going to start shifting on the other side, which is going to create some more herniation, which is going to give you some problem in the long run. Is there any easy stretch? I'm just answering this question here. Is there any easy stretch to get rid of sciatica? Well, again, it depends. If the muscle is tight, yeah, you can use the stretches to get rid of it. But again, if it's a herniation, if it's of the other things, you can't really get rid of it. But some of the very famous stretches that we talk about when it comes to sciatica is stretching the piriformis muscle. And very easy. Don't know if you can see me here, but sitting down here and getting on the figure 4 here, leaning forward, that's a good stretch to actually alleviate some of the tension in the low back, but also getting rid of the sciatica here. Okay, so the muscles you want to stretch is usually the glutes. You want to stretch the hamstring because tight hamstring can cause that. You want to stretch the piriformis. So any of these stretches that can actually get you in a position to stretch those things is going to allow you to feel better. Okay. Again, it's all about feeling better, but the stretches, unless you get to the root cause of the problem, are not going to completely get rid of sciatica, but it will get you through the day to be able to do that. So if you're somebody that's sitting a lot in front of a computer, you need to get up every 20, 30 minutes and move. And some of these stretches here, you can do it the figure 4, just being in that position and don't want to turn my back, but bringing your legs up this way to kind of stretch the hamstring. These stretches going to help you get rid of that. How can posture affect low back and what can be done to improve it? That's kind of what I was alluding to earlier. Posture is key when it comes to everything, when it comes to health. Big statement, right? But your health is determined by your posture, because when we look at the spine, if you can see this, every single communication from the brain has to go through the spine to get to every part of the body. That's called your nervous system. Your nervous system controls everything about you, every cell, tissue, organ, muscle, etc. So if you have bad posture, there's no possible way you can be healthy, because health is having all your cells functioning at 100%, having your nervous system functioning at 100%. And the nervous system cannot function at 100% if you're in that twisted, crooked position like that, okay? Because that's going to put pressure in some of these nerves, which is going to create interference between the brain and the rest of the body, creating pain, symptoms, and disease in the long run. So it's really important that posture is good, because when that happens, you're going to take pressure off those nerves. And again, that's what's going to be one of the number one things to kind of get rid of sciatica. What can I do at home to prevent or manage back pain? I had a fall a few weeks ago and at time feeling my back. Okay, so trauma causes back pain. I'm going to take this the long way to answer that question. So when you have a fall and injury, typically what happens is the pain happens wherever you hit. So in this case, you had a fall and you hit your low back and there's pain and inflammation in the low back. Here's the thing. The majority of the time, you're going to focus on the back. You're going to focus on the pain that's happening in your low back, which is right. So you want to ice it down for the first 48 hours. Make sure there's no fracture or anything like that. You want to put some heat on there to kind of get the muscles after the 48 hours. You want to do some stretches. If it's really painful, take some anti-inflammatory. Make sure you go get checked, because if you felt that bad and you break something, you want to make sure that you get the proper care. But here's the one thing that we don't think about. Force always travel to the path of least resistance. That's something that we've heard since we were kids. So what's happening is when you have any kind of trauma in the body, the force is going to travel to the weakest point. And if you're able to look at the spine here, right there, look at the way this is designed. At every vertebra here, there's a disc, except for right in the top vertebra there, which is the atlas. There's no disc above, there's no disc below. Also, the atlas is the smallest bone in the body. It's a 2-ounce bone that holds the head. So when you have that kind of trauma that happened in your body, where do you think the forces go? All forces that happen, it actually goes here and knock the atlas out of position. Now, the atlas is key, just like I've been talking about. Part of the brain exit the skull, the brainstem sits right between the atlas and the C1 vertebra, right there. So whenever you have that kind of trauma and that misaligned that atlas, now you have a problem. Initially, it doesn't cause any pain, any symptoms, or anything like that. But the longer this is out of position, the more pressure that's happening in the brainstem, the less communication that's happening. And now you start having misalignment throughout the entire spine that creates bad posture. And we already talked about that. When there's bad posture, there's possibility to have nerve interference, and with nerve interference come pain, symptoms, and disease. So what typically happens when somebody has a kind of trauma like you did, you have the back pain, you go to the doctor, you do the ice, you do all the things necessary to get rid of the back pain. And if you do all the things right, the back pain goes away and you fix. That's great. But don't forget that force traveled to the path of least resistance, which is the atlas. Now that you think you fixed, if you don't actually go get that checked, 5 years down the line, 10 years down the line, you're going to come down with other symptoms that seems to not make sense. I've never had these things before. Why am I having migraines? Why am I having headaches? Why am I having tinnitus, vertigo? All of these things that's happening. And most of the time you go and get all that checked and all your examinations are negative. So there's nothing technically wrong with you, but you're suffering with all these things. And the reason for that is that atlas has been out of position for a long period of time, ever since you had that initial accident or incident that's putting pressure on that brainstem. And now you're experiencing all the ailment that may happen with an atlas misalignment. Okay. So to you, I highly recommend, yes, you get this fixed, but also make sure that your atlas get checked, because if you have that pressure and it's there for a long period of time, in the long run, you're going to be having some issues that nobody can explain what's going on. So do yourself a favor, get this check and also get that check. So that brings me to what the atlas is. Okay. So when we're looking at the atlas, it's a 2-ounce bone. Again, NUCCA doctors is what we work with, the atlas, and we're not adjusting the atlas, we're adjusting the entire spine. We're just using the atlas as a lever to be able to kind of get everything back into proper position. So how can the atlas help with sciatica? Exactly what I just answered. If the atlas is out of position, it's going to create a domino effect. So when your head is tilted forward, you've never seen somebody walking down the street like that. Okay, they don't walk like that. Typically, when it's tilted forward, they're also going to have their hip rotated forward. Okay, so you have that C shape here that's happening. If you have a head tilt to one side, typically your body will compensate on that side, or sometimes it can compensate on the other side. So you have that crooked position here. If there's a rotation, everything's rotated. So everything that happens up here happens up here. So if I'm walking around and this position, twisted and rotated, do you think that that can cause sciatica? Absolutely. Because in that position, not only are you going to have tight piriformis, you're also going to eventually end up with herniation. You're also eventually going to end up with spinal canal stenosis. All these things are going to be misalignment. And then you're going to have sciatic pain that goes down the leg. And, you're going to fix all these things. But until you get this back into position, you're always going to be back out of position. So that's why we are so successful with taking care of sciatic pain, because we go straight to the source of the problem rather than fixing the symptoms. So what does it look like when you come in to be able to determine what's going on? Again, everybody that comes in, we do a thorough consultation with you to figure out the source of the problem. When did it start? What happened? One of the questions I always ask is that, have you had any trauma? And I can't tell you how many times people say, no. It's like, nope, nothing happened to me. Because when I say that, you're thinking of something big, like a car accident or a house falling on you, or something big. But typically it can be something minor. You can just be walking down and just that alone can happen many, many times. And 99 times out of 100, you're fine. But it takes that one time when you do something that seems minor that shift the atlas out of position. Again, that doesn't cause any pain or symptoms. And the best analysis I can give you is that if you drive in a car and you hit a pothole, nothing wrong with the car. You don't feel it. But at that particular moment, there's a possibility that you have misaligned the car. And now you're driving your car out of alignment, and you can drive the car fine mechanically. There's nothing wrong with the car. However, because it's misaligned, you may see that the car deviates a little bit. But what's really happening is that your tires are being worn down unevenly. And if you drive the car enough, eventually you're going to have the tires going to explode. So, but the explosion is not the problem, is when you misalign the car. So same thing, that tiny thing that you did, misalign the atlas, now you're walking around fine, but that misalignment is creating degeneration, arthritis, creating inflammation in the spine. And all of a sudden, one day you experience sciatica, but the problem happened when you misalign that thing. So what are some lifestyle changes that can be made to reduce frequency and severity of sciatica? All right, good question. Now, somebody also asked a question about nutrition. How can nutrition help you with sciatica? bottom line is sciatica is an inflammation of the sciatic nerve. So you want to stay away from inflammatory food. Okay, things that you know already, things like sugar. I mean, you should just get rid of that altogether. If you're drinking soda, if you get eating fried food, if you taking anything that's that's not organic, things like that, eating processed meat, things that's gonna actually create inflammation in your body is most likely to cause sciatic issues because again, that's inflammation in the long run of the sciatic nerve. So what can you do? It's not a nutrition class, but you want to start eating things that are anti-inflammatory, legume, nuts, seeds, organic. You want to eat things like protein, like fish. All these things that's going to allow your body to actually heal is actually going to get you to feel better. So it's not only, the stretching. People are always talking about the stretching. Yes, but you got to heal from inside out. So the things that you put in your body is either going to help you get rid of it or promote inflammation. And of course, hydration is key because a lot of time, if you don't hydrate, then the body gets in that fight or flight, and that can actually contribute to what we talk about as far as sciatica. So lifestyle changes, again, one of the biggest things that I've seen in my practice nowadays is because we're spending so much time sitting down. We on our tailbone, pelvic rotated forward, putting pressure on the piriformis, creating that misalignment. Then people start having herniation and sciatic pain. So lifestyle change, you need to move. Start moving. I usually recommend that if you're sitting down, make sure you get up every 20 minutes and move around. But also exercise is so important. After sitting for 8 hours, you need to get out and move. And I recommend that everybody does at least 30 minutes every day of walking. Again, if you're doing more, that's great. But that's the minimum, that you're actually moving, get those joints moving, get your heart rate up. Because a lot of time, what do? We sit 8 hours a day on Zoom. We get home, we sit on the couch, or we eat at dinner, we're sitting, and then we sit on the couch to watch TV, and we're in that position, and then we go lay down on our stomach for it. That's so much trauma in your entire body, entire spine, and you wonder why you have these inflammation. So those lifestyle changes, just like we talked about, make sure your posture is good, make sure that you're moving, make sure that you're eating properly, proper mental attitude, and do all these things to be able to allow the body to heal itself. What are some more questions that we have here? What should you expect doing a NUCCA adjustment? Oh, okay. So as far as lifestyle changes, that's a good thing. Now, again, pregnancy is one of the things that can cause sciatica. Again, what does a pregnant woman look like? You get that belly where everything's here, and now the pelvis goes down, and now you have it's very common. A lot of time, pregnant women have back pain and sciatic pain because everything's there. But there's a lot of you that's not pregnant, but you still have that belly. And how do you expect not to have sciatic pain? Okay, one of the things you can do, get rid of that belly, get that posture, because when you're in that position, you're putting tremendous amount of stress on the disc, you're putting tremendous amount of stress on those nerves, and then every time you walk, that's extra weight that's bouncing on the spine that may cause sciatic pain and back pain. So yes, the adjustment's going to help. Eating properly is definitely going to help, but you need to lose that weight to kind of get the body to function properly. It's really, really important. What was the other question I was talking about?
I have another question.
Yes, please.
There's another question. How does a NUCCA exam look like to people out there that don't know?
Aha, yes, that's a good question.
Like, is there cracking, twisting, or how does it work?
So what does NUCCA involve? And I started talking about this. Again, first of all, we need to figure out what's going on with you. So we'll sit down for about 15 minutes, really pinpointing what's going on, what happened, what are you suffering from, and try. A lot of time during that conversation, we're going to actually figure out what happened. Because again, we don't think about it, but once I start talking to you and telling you, hey, do you have any trauma? What happened? And all of a sudden we start figuring out and painting a picture of what's going on. And then what we're going to do is a complete nervous system examination. Most people that you go see, if the pain is here, sciatica, they spend all their time examining the sciatic nerve. Just like I talked about earlier, this is what we call a secondary condition to something greater. Okay, so rather than focus on our effort here, and patients are always amazed, it's like, wait, I spend all my time here and you never looked at my sciatic. It's like, I don't have to. I'm going straight to the source. So what we do, we take you in the room and we do a complete nervous system assessment. Why? Because the nervous system controls everything in your body. If there's interference with the nervous system, that can cause that. So we go straight to the primary. So the nervous system evaluation include some surface EMG looking at muscles, the nerve that goes to the muscles. We do thermal scan that's going to look at the nerve that goes enter into blood vessels, organs, and glands. We're going to do a range of motion that's going to actually look to see if there are any restriction, any flexibility issues that may cause thickness in the spine that can cause inflammation and sciatic. And then we're going to do a heart rate variability test because we also want to see how your body is functioning, looking to see whether you are in automatic and parasympathetic and sympathetic nervous system, looking at the heart, so we get a complete idea how your nervous system is functioning. After which, again, we're going to do the bilateral weight scale to see if you're putting more weight on one side versus the other. And we're going to do a posture test, and this is a digital posture test that's going to look at to see whether you are standing like that, also from the side, whether you're like that, because that's vitally important. Because if your posture's off, chances are you have misalignment, nerve pressure, that's going to cause pain. Then we're going to look at your feet. Now, that's the machine that you look at here. Very important, because when we talk about sciatica, if the foundation of the feet are not working, your arches are off, guess what's going to happen? Biomechanically, you're going to send pressure all the way up to the spine. The way I like to compare this is the shock absorbers in your car, okay? If you have good shock, you can drive fine and you don't feel anything. If your shocks are not working properly, you feel every bump. Same thing. The arches are the shock absorbers of your body. So if your arches are flat or you have fat feet, every step you take biomechanically, you're going to feel everything, which can cause misalignment, again, leading to sciatica. So that's why we do this test. And then the most important test of them all, x-rays. Where do we take the x-rays? Here? No, that would be silly, because then we'll be looking at the secondary condition rather than the primary. And again, the primary, everything comes from your brain. So we want to make sure right at the exit of the brain, which is the C1 vertebra, that there is no interference, no rotation, no misalignment, because if there is, that's going to transit all the way down. So we're going to take a series of x-rays to determine whether you have a misalignment up here, because when the atlas is off, it creates a domino effect that misaligns the entire spine, which can lead to pelvic issues and sciatica. So the goal is to realign the atlas and see what's going on. So once we take the x-rays, they go to our radiologist. We get a report within 24 hours to make sure there's nothing going on. And then we can safely go over the results with you and start the adjustment of the atlas. So it's very gentle. There's no popping, no twisting, no cracking. So if you're afraid of that, don't worry. We don't crack here. Okay, it's a very gentle adjustment. If you were to put a quarter on your hand here, the amount of pressure, that's what we're going to use to do the atlas. And the reason for that is so precise. Based on the x-rays, we're able to determine the exact vector, how to apply the force to bring the atlas back. And then when the atlas is back, everything realigns itself, and that takes pressure off the sciatic nerve. Okay, so that's the key in how we do it and how we are able to get people better with sciatica. Let's see, a couple questions. How long does it take to see results from chiropractic care from back pain? I know you're not going to like to hear this. It depends. Everybody's different, okay? Research shows for every year that you've been out of position, it takes at least a month of care to get you better. Again, keep in mind, my goal is not to get rid of pain, okay? I know that's what brings you in, but that's not my goal. My goal is to restore nervous system function to as close to 100% as possible so the body can heal itself, okay? Now, again, if all that you were seeking is to get rid of pain, of course, you can take enough ibuprofen, enough painkillers to get rid of the pain, but my goal is always to get rid of the problem so you don't have the pain, okay? So everybody's different, but once we analyze the x-rays, we'll be able to tell you based on what we see and the amount of degeneration or arthritic changes that's there, oh yeah, this is going to take a month, this is going to take 2 months, this may take a year, but it's all based on the individual examination to be able to determine what's going on as far as the level of degeneration that's happening there. Another question is, what are some signs that someone with lower back pain should seek medical attention? All right, so again, one of the things I talked about as far as can cause sciatica, you can have a tumor, you can have a fracture. So if you had an incident or an accident where you're feeling the sharp in the sciatic pain, but there was a fall, and you starting feeling numbness, there's no feeling in your legs at all, or it's like it feels so heavy that you can't move it, then you want to seek immediate medical attention. Again, if there's ever any trauma, I want you to go to the urgent care or the emergency room to make sure. Do your due diligence because you want to make sure. Now, also, if you have any lumps or any things that you feel that's out of position, or if you feel tired, exhausted, things like that, then you want to actually make sure that you go see somebody, because there might be a tumor in the spine. There are a number of things. So medical emergencies should be whether there's a trauma that happened directly to that area, or there's symptoms that really doesn't only go with sciatic pain. It's like once you start feeling that there's no feeling, your legs are feeling cold, things like that, then you want to actually seek immediate medical attention. Okay. So one of the things I always ask my patient when they come in, who else have you seen for this? Because typically most people don't come see me on the first day. I wish you guys would, because we can fix the problem. But most of the time, patients of mine have seen physical therapy, they've been to orthopedic, they've been to other chiropractors, and then I'm typically the last resort because it doesn't make sense to you. Why am I here when the problem's here? But that's why we get great result, because we go straight to the source of the problem and not the symptoms. Okay, if that makes sense to you, great. If it doesn't, give me a call. We'll be able to tell you exactly what's going on. All right. Any other questions? I'm just looking. Let's see. What else can I talk to you about? Hi, Christy. Let's see. What questions do I have here? What should we expect doing? Oh, how does NUCCA differ from other chiropractic technique? Okay, so let's talk about this. Chiropractic as a whole is not about back pain, neck pain, headaches, or anything like that. Just like I mentioned earlier, chiropractic is all about balancing out the spine, because the spine houses the nervous system. Okay, so here's what chiropractic is in a nutshell. This is your spine: cervical, your neck, thoracic, lumbar. Why is this important? These nerves that comes out of here. Okay, you have your skull, which houses your brain. You have the spine, which houses the spinal cord. That is what controls every aspect of your body, every cell, tissue, organ, muscle, every other system in the body, the immune system, the endocrine, the respiratory, everything's under that system alone. That's the master system. So as chiropractors, what we're looking at is to make sure that everything is in proper alignment, because if it is, then the communication can go from top to bottom and back and forth without any interference. Okay, so that's what chiropractic is all about. It's not about neck pain, back pain, headache. It's about making sure that the neurology in the body is working properly, so the brain and the body can heal itself. The body is a self-healing, self-adapting, and self-regulating mechanism. It can do everything on its own as long as there's no interference. So as chiropractors, what we're looking at is to find the interference to get rid of it. Now, how we choose to do that is different. Again, just like there are different specialty in medicine, there are different specialty in chiropractic. However, most chiropractors, what they're looking at is, let's say they see this is out of position, their goal is to pop it back into place. This is out of position, let's pop it back into place. So they're analyzing the spine to look for misalignment, and where they find the misalignment, they do an adjustment that's going to bring that spine into place. How do we differ from that? Okay, just like we talked about, I don't do all this, I simply do that. Have you ever heard of less is more? Well, this is the case. By adjusting here, because keep in mind, we talked about that there can be force that travel to the path of least resistance. So instead of looking at this, I'm looking at the position here, because that's literally the root cause. When this is out of position, it creates the domino effect. So rather than looking at here to fix this, to fix that, I'm simply looking here. And if I'm able to get this back into position, realign the skull on top of the atlas and the rest of the spine, guess what? The body will self-adjust back into proper position. Okay. Once you fix this, everything else falls into place. So rather than looking at each individual bone, I go straight to the source, the main thing where the brainstem sits, get everything back position, everything actually heals itself. So that's kind of the main difference. I don't want people to get the wrong idea that, other chiropractors can't fix sciatica. They absolutely can. However, when that fails, you come see me, because if they're not addressing the atlas, sciatica is always going to come back. Okay, so that's why we get such great results, because we are unique in the fact that we go straight to the source of the problem to realign the entire spine to allow the body to heal itself. What is the difference between acute and chronic pain, and how should we treat it? Well, acute pain is something that's cute. Okay, never mind. That's acute is something that just happened, something that's fresh, or chronic is something that's been going on for a long period of time. So how do you treat that? And again, when we talk about acute pain, it's something that just happened. That can also be a misnomer, because even though it may seem acute, just like I talked about in the case of the misaligned car and the tire, at that point, the tire exploding is an acute condition, but it was due to a chronic misalignment. So a lot of time when we're talking about acute pain, I see people in the office that come in all the time that says, "Oh my God, doc, this just happened yesterday. I've been down to pick up a pen and my back went out, and now, that's acute because it happened yesterday." But the symptom is acute. The problem is chronic. Okay, I don't know if you follow. Acute is something that's happened immediately, something that's just started, something that's fresh, that's been there for just a short period of time, versus chronic is something that, I see people that all the time that come in. How long have you had back pain for? Oh, it's my normal back pain. I've had it for years. That's something chronic. But you can also have things that are chronic that can become acute and go back and forth. So what we're looking for when you come here is the chronic misalignment that's giving you the acute symptoms. Okay, so I don't know if that actually makes sense to you. I hope so. But a lot of time, the acute things that we talk about sciatica that just happened, the symptoms acute, but the problem is chronic. Okay, so that's why we don't go straight to the symptoms, because the symptoms can be misleading. The symptom just telling you something that's happening now, not the cause of it. So the cause is going to be able to determine that. Now, okay, so I just answered that.
Another question is, what other things can NUCCA treat aside from sciatica?
Aha! Well, see, I hate that term, treat, because NUCCA doesn't treat anything. Chiropractic as a whole doesn't treat anything. Again, what we fix is this. The body will fix itself. So what are some of the things that NUCCA can actually help with? Would it be presumptuous of me to say everything? Yeah, don't look at me crazy. NUCCA can help with everything, because what we're looking at, again, is not the symptoms. I know that's what drives you in the office, the symptoms. I have this pain here. I have this problem here. I have the vertigo. I have the neck pain. That's what drives you, which is fine. But keep in mind, all those are secondary condition to a primary misalignment of here, okay? Trauma, and again, we talked about this, but trauma can happen at birth. Trauma can happen something that's insignificant. Something happened that locks that atlas out of position, okay? That in itself can cause a variety of secondary conditions. And so my goal is to fix that and get everything working properly. So some of the things that have the greatest success within the office are things that are neurological based, okay? I see a lot of patients. I think the most patients I've seen is people with migraines and headaches. Because again, we're so close to the brainstem, headaches. I see a lot of people with tinnitus. Vertigo is a big thing. When we talk about people with tinnitus and vertigo, all of them that come to my office, I've already seen ENTs. They've gone to the medical doctor, and typically all these tests are negative. And the only thing that they can put them on is either give them an hearing aid, which they don't need, or give them anti-inflammatory steroids and stuff like that. But again, if there's a misalignment here, I have found that a lot of time, I would say 80% of the time, that misalignment is what causing the tinnitus, the vertigo. So again, I'm not treating any of that stuff. I'm just removing the misalignment, and that itself get people better. Okay. So what can NUCCA fix? Nothing and everything, because what we're focusing on is realigning the master system in the body, which is the nervous system. So if there's anything wrong with you and you've never had, see, this something that, I always think that's funny, and it's not your fault, because that's how you've been trained. Now, how many of you listening here have gone to your doctor for your annual visit? Okay. And what did they do? They check your heart, they check your blood pressure, they check, your eyesight, they check your hearing, they check everything. Okay, which is great. But how many check your nervous system? When was the last time either of you, all of you, have had a nervous system evaluation? And we just finished talking about your nervous system controls everything in your body. So the heart that you checking, your blood pressure that you're checking, you go to your annual checkup. If you don't have this working properly, nothing else will work properly at 100%. So we so focus on looking at the parts, but we're not focused on looking at the main thing. Okay. So I urge you, if you've never had your nervous system evaluated before, give me a call. Okay. If you're not close, if you're in other state and you're watching this, give me a call. There's not that many NUCCA doctors in the world, but I'll be able to connect you to somebody that does this in your area. Or you can fly and see me. That's fine. But make sure you have your nervous system evaluated. And I'm going to say this now, and I might get yelled at, but I just came up with this. If you are watching and you've never had your nervous system evaluated before, and you want to, come in the office. This is going to expire today. Okay, it's going to expire today. So if you're watching and you know somebody that wants to come in, or you want to come in, give us a call today. We are in the office till 7:30. If you call us and make an appointment, I'm going to give you $200 off of your entire testing. Okay, don't yell at me. Today only. Okay, so give me a call. We have somebody at the front desk. We'll be able to give you this biggest discount because I want you to be healthy. Okay, and the only way to be healthy is to have your nervous system evaluated. So therefore, you'll be able to do that without any issues, and we'll give you a $200 gift card to be able to do the entire test without any issues. Okay, so only today. So if you're watching this at another time and call me, it's not gonna work. So if you're watching this and you know anyone in your life that should get this done, give me a call. We'll put the appointment. They don't have to come today, but they have to schedule the appointment today. All right. So I may do this next time. So it's important that you guys watch these lives, because every time we'll do these lives, we'll have a thank you gift for you spending the time with us. So that's what I'm doing today. So give me a call and let's do that. All right. Any other questions?
Where are you located?
Where am I located? That's a good question. Oh, what's the number? That's even a better question. I'm telling you to call, but you can look it up. But the phone number is 561-409-3594. 561-409-3594. And all my things on social media, you can find it. We are located in Mid-Boca, between Powerline and Palmetto. So 73018 West Palmetto Park Road, Suite 304B in Boca Raton, Florida. All right. So please give us a call. We can help you. If you suffer from sciatica, or anyone that suffers from sciatica, give us a call. The problem is not in your butt. The problem is in your neck. It's always funny where people say, yeah, the problem's in your head. Well, they're right. It is in your head, but it's not where they're thinking. It's right at the base of the skull, at the atlas. So come get a nervous system evaluation. Let's get your atlas back, and let's get rid of the pain in your butt and everywhere else. All right. What's we doing next week? Now in 2 weeks. What's the topic?
The topic is
something. Is it ear infection or chronic infection?
Ear infection.
Infection is something. So look at the schedule and come back with us in 2 weeks. Same time, same place. Again, if you are live, you get a deal. So make sure you tell your friends, and we'll post it and let you know. So, and of course, if you missed this, there'll be ways that you can watch it again. So thank you for joining us, and we look forward to seeing you. Go on my YouTube channel, you'll be able to see it. All right. Hopefully you guys got a great information. And if there are any questions that you didn't get in, please text us or send us an email. We'll be able to answer that for you and get you going. All right. Dr. Jean-Pierre, your favorite NUCCA chiropractor. Peace.